My name is Raylene Wilson. I'm a physician assistant and volunteer with Remote Area Medical, also known as the RAM team. We have been working with the Guyana Ministry of Health and the Ministry of Amerindian Affairs since 2003. The goal of our program is to identify and treat women with cervical cancer and the conditions that lead to cervical cancer. Cancer is a disease that most people are familiar with. Cancer is when the cells of the body grow out of control and begin to grow into and invade other parts of the body. Cancer cells can even move from one part of the body to another and then begin to grow in this new area. There are many different types of cancers, for instance, breast cancers, lung cancers, and skin cancers. Cervical cancer is one of the most common causes of cancer death in women in developing nations like Guyana. Death from cervical cancer is preventable. This is a picture of the female reproductive system. You can see the outside of the vagina. This area is called the vulva. Here is the vagina, and above this, the uterus. The uterus or womb is where the baby grows. Above the uterus are the ovaries and fallopian tubes. The eggs are made in the ovaries and carried to the uterus in the fallopian tubes. The cervix is the lower part of the uterus. It is the narrow neck of the uterus and can be seen from inside the vagina. The cervix is the strong muscle that holds the baby inside the uterus until the time of delivery. At delivery, the cervix becomes very thin and wide open to allow the baby to come out of the uterus. When a woman has cervical cancer, the cells of the cervix have changed and become abnormal and are growing out of control. These cells can even leave the cervix and grow in other parts of the body. Cervical cancer begins as changes in the cells of the cervix. The cervix is covered by skin, like the skin inside your mouth. This skin is made up of cells. These cells are always growing and being replaced by new cells. A test called a pap smear is used to collect some of these cells from a woman's cervix so that the doctor can look at them under a microscope and see if they are healthy and normal or if they are abnormal. The cells are collected by gently rubbing the cervix with a soft brush. We do not remove or cut away any part of the cervix for a pap smear. The brush that has the cells on it is placed into a bottle of liquid. The liquid is then placed on a glass slide so that the doctor can look at the cells. This is similar to when the malaria worker looks at a malaria smear under the microscope to see if you have malaria. With a malaria smear, there are two possible results, either positive or negative. With a pap smear, there are 5 possible results. The first possible result is normal. This means that the cells of the cervix look healthy and there are no problems. The second possible result is dysplasia. Dysplasia means there is abnormal cell growth. In dysplasia, changes are seen in the cells of the cervix that may be pre-cancer. The third possible result is cancer. The cervix cells show changes that are cancer of the cervix. A pap smear does not look for other types of cancer. The fourth possible result is atypical. This means that some of the cells do not look normal, but do not look like dysplasia either. These cell changes may be caused by infection, aging, or precancer. The fifth and final result is unsatisfactory. This means that there were not enough cells collected in the pap smear to be read, and so there is actually no result. Each of the 5 results has different treatment recommendations. For women with a normal pap smear, there is no treatment needed. they should have another pap smear again in the future. A woman with an unsatisfactory pap smear will be recommended to have another pap smear because there were not enough cells collected on the first pap smear to get a result. Women that have atypia, dysplasia, or cancer on a pap smear will be recommended to have an examination called a colposcopy. In this examination, the doctor will use an instrument like a microscope to look at the cervix. This is called a colposcope. The colposcope will make the cervix look bigger. The colposcope does not touch you, but is only used to look through. The doctor will look at the cervix carefully to see if there are any areas that look abnormal. This examination only takes a few minutes and is like having a pap smear. If an abnormal area is seen, the doctor will take a biopsy. A biopsy is a small piece of tissue about the size of a piece of rice. You may feel a pinch or cramping feeling during the biopsy, but not a bad pain. After a colposcopy exam, you can work or have sexual intercourse. The biopsy will be looked at under the microscope. Based on the result of the biopsy, the doctor may recommend that the woman have treatment. There are different treatments for women with abnormal cells on a biopsy that depend upon the biopsy results. None of the treatments for abnormal cells of the cervix are tablets. There are no pills or medications that we can give to treat dysplasia or cancer of the cervix. If the biopsy shows only a little change of the cells of the cervix, we call this mild dysplasia, or CIN1. This is not cancer and will probably not become cancer. Women with these kind of cervical cells will be asked to have another pap smear sooner than they would if the pap smear was normal. No other treatments would be needed. If the cells on the biopsy are more abnormal, we call this moderate dysplasia, also called CIN2, or severe dysplasia, also called CIN3. This means the same as pre-cancer. These cells are not cancer, but could become cancer if they are not treated, and that is why treatment will be recommended. The treatment for moderate and severe dysplasia is called a LEEP. LEEP stands for Loop Electrical Excision Procedure. This procedure is done in the clinic by the doctor. During the LEEP, the doctor will look at the cervix and then will cut away the part of the cervix that is abnormal. Medicine will be used to numb the cervix so that the LEEP does not hurt. The abnormal cells will be removed in the same way that you could cut out a bad or rotten spot on a pumpkin and leave only the good pumpkin. After a LEEP, you will be asked to do no heavy work for 3 days and not have sexual intercourse for 2 weeks so that the cervix can heal. You would also be asked to have extra pap smears after your treatment. If the cells on the biopsy show cervical cancer, the doctor will recommend special X-ray pictures called CT scans to be done to see if the cancer has spread. If the cancer has not grown outside the uterus, a surgery called a hysterectomy can be used to treat the cancer. A hysterectomy is done in a hospital, usually in Georgetown. During a hysterectomy, the woman is put to sleep so that she will not have any pain, and the doctor will remove the uterus and the cervix. It will take several weeks to heal from the surgery. She will be asked to not do any heavy work or have sexual intercourse for 4 weeks after surgery. If the CAT scans show that the cancer is growing in other parts of the body, radiation therapy will be recommended to treat the cancer. Radiation therapy uses strong X-rays to kill the cancer cells. All of these treatments are offered free by Remote Area Medical. You have the choice to have the treatment or not. If you don't want to have the treatment, no one will make you. As I mentioned before, cervical cancer is a very dangerous disease. If the disease is growing outside of the cervix, it's very hard to treat. Even women with the best medical treatment may die from a large cervical cancer. A pap smear is a test that is used to find abnormal cells of the cervix before they become cancer. Remember that moderate and severe dysplasia can be treated in the clinic with a LEAP procedure. Now, I would like to talk about the symptoms of cervical dysplasia and cervical cancer. Cervical dysplasia will cause no symptoms. Women with cervical dysplasia will not know that they are sick. They will not have abnormal bleeding or vaginal discharge or pain from dysplasia. Women with a cervical cancer that is small will have no symptoms either. As the cancer grows and spreads to other areas of the body, the woman will have symptoms. The first symptom is usually vaginal bleeding and discharge with a bad smell. When the cancer grows outside the cervix, there can be pain and blood in the urine and stool and other serious symptoms. It takes many years for the cells of the cervix to change from normal to dysplasia to cancer. This means that there are many years that a pap smear could find these problems and a woman can be treated and her life saved. There is a virus that causes the changes of the cervix that can become cervical cancer. This virus is called HPV, human papilloma virus. This is not the HIV virus. HPV is actually a group of many types of viruses. Some cause no symptoms, some can cause warts on the feet, some can cause warts on the genitals, and others can cause changes in the cervix that can become cancer. HPV is very common, and most people will have the virus at some time in their life, but only some women will get cancer from it. Men can have the HPV virus and can have genital warts, but because men do not have a cervix, they cannot get cervical cancer. Most people with HPV infection on the cervix or the penis do not know that they have it and have no symptoms. Usually the body will get well without us ever knowing, but in some people the body does not get well and the virus stays on the cervix and can cause the cell changes that become dysplasia and cancer. HPV is spread from one person to another. It is not spread in blood or breast milk like HIV, but like HIV, it is spread through sexual intercourse. Being faithful with your partner, using a condom, or abstaining from sexual intercourse will help protect you from HPV and HIV. But remember, HPV is very common. Most people will have HPV at some time, and most of them will get well from the virus without ever knowing that they had it. Women that have never had a pap smear want to know what it is like to have this exam. Many women are nervous about the exam because they do not know what to expect. The exam is very simple and quick. It only takes 2 or 3 minutes to have the exam and pap smear. During the exam, the doctor will ask you to take off your shorts and underwear and lay down on the exam table. The doctor will look first at the area around the vagina to make sure the skin there is healthy. Then the doctor will use a speculum to look at the cervix and collect cells for the pap smear. Finally, the doctor will feel inside and make sure the cervix, uterus, and ovaries feel normal. Most women will have no pain from this exam. Some women will have light vaginal bleeding called spotting. for 1 or 2 days after the pap smear. This is normal and happens because the tissue on the cervix is thin and may bleed when rubbed. You can do all of your normal activities, including sexual intercourse, after a pap smear. All women aged 21 or older are recommended to have a pap smear. It's no problem to have a pap smear if you are menstruating, pregnant, or have reached an age where you no longer have periods. That's called menopause. All of the pap smears done by the RAM team are read by doctors in the United States. The results will be brought back by the next RAM team or sent to you directly. It usually takes about 6 months to get your results. If you do not come to the clinic, we will leave your results in a sealed envelope at the clinic where you had your exam. If you need treatment, we will tell you what to do. A pap smear is a safe, easy, and painless test that all women should have. It is offered free by RAM and it is used to find changes in the cervix that become cancer. Cervical cancer is a very common and deadly disease. Having a pap smear is the only way to prevent cervical cancer. Thank you for your attention, and we wish you good health. And we wish you good health.